Hi, my name is Sarah, and I'm a nurse coordinator for regional pain care at Virginia Hospital Center, now VHC Health. I'm here today to speak to you about the use of the On-Q pump for pain control. This pump has a non-narcotic pain medication in it called ropivacaine in the same family of drugs as lidocaine or novocaine, much like you would receive at the dentist. You are watching this video today because your provider has worked with your anesthesia team and recommended this form of pain control for either a serious injury like rib fracture pain or for post-surgical pain. What I'd like to do today is teach you how simple it is to use this medication when you go home, and we discharge many patients home with this medication, and give you a little bit of a feel for if you stay in the hospital for some time, what it will be like to have this going. You will first get the chance to talk to your anesthesiologist, who will speak to you about the risks and benefits of all types of anesthesia care. When the anesthesia provider and you decide that this is the best and safest form of pain control for you as a part of your overall pain care plan, you will proceed with getting the catheter for the pump inserted. This catheter is about the size of a thin piece of dental floss, looking like it's wrapped in metal. This procedure to start this medication is done while you are under some level of sedation to make you more comfortable. Once the procedure is done and the catheter is in place, it is taped to your skin such that it will not be removed or dislodged very easily. From that catheter, there will be a little connection point where we, as your nursing team, hook up your pump before you leave the hospital or prior to you going to an inpatient floor. Let me show you where that connection is now. Here in this box, you will see an example of how the catheter is taped to the skin and is then able to be connected to the pump. So this thin wire here is the size of the catheter, and it is taped to your skin by a series of pieces of tape and devices such that it doesn't remove from your skin easily. The doctor will then leave the connection point capped such that your pump can be connected. You will notice when you wake up from surgery or from the procedure that your pump is connected just like this. This is how the medication is given to you over time. Now that we've talked about how the catheter will look on your skin, let's talk about how the pump will look as it decreases in size over time and gives you medication. This is the size of one of our full pumps, and you can be prescribed a couple of different sizes of the pump itself. Again, this is filled with ropivacaine medication. It is a non-narcotic and can be used alongside all other types of pain control that you will be receiving. We will decrease other types of medication that you have in the same family of medications, like lidocaine. This pump has attached to it a thin set of tubing. It has a clamp that ensures if an emergency were to happen, that we could quickly stop the infusion, and you may do this as well at home. And then it also has a dial. This dial is managed by the nursing team when you are in the hospital, and you actually can manage it yourself when at home. When you're in the hospital, you will notice that a small zip tie is attached to keep the container closed. This zip tie simply sits right here and just helps us from ensuring the top comes open like so. We want it to stay closed such that the rate at which your medication is going stays the same. If ever the nurse needs to change the rate, or you need to change the rate at home, you can simply cut the zip tie with a pair of scissors. When you open the SelectaFlow dial, you can simply turn it up or down, whatever you need for your pain control. Most patients will go home at a lower dose, and we expect you to possibly need to turn it up over time. So you will simply open the case, turn the dial to whatever number you need, and close it back. You can just affix a small piece of tape here so that it will not flap open while you have it at home. I also want you to know that you cannot overdose yourself on this, as it is a non-narcotic numbing medication. If you went up to 14, which is our maximum, you simply will be number a little bit faster, and the medication itself will run out faster as well. The medication that is in the pump is actually in a double layered pump. So over time, what we will notice is the inner layer that holds the medication shrink over time, and the outer layer will show more and more wrinkles. Let me show you what it looks like as it decreases over time. This is a half empty container, where as you can see, the inner layer has started to shrink and the outer layer has started to wrinkle. This is how you know it is working. I do want to note that the ball will appear quite large and quite tight for some time. It does take some time for it to significantly look as though it is infusing. Again, you will notice the wrinkles on the outer layer to know that it is working. The last step in the process for the pump is when it is completely empty, and it will look like this. It's actually a very hard, palpable core that almost looks like a squirrel ate an apple down to its core. Whenever you notice that your pump is empty, even if you've been asleep and it's been empty for several hours, when it is empty, you will know it is safe to remove it. Let's talk a little bit about the removal process. From wherever the insertion point of the catheter is, which will be relatively close to the site of your surgery, you will want to peel all of the tape leading up to the surgery site back until you're at the insertion point of the catheter. So let's say, for instance, that you had rotator cuff surgery on your shoulder. You will have the catheter inserted somewhere in this region because that is what bathes the nerve bed for your pain control for your arm and your shoulder. And your catheter could either be taped on this side or possibly even on the other side, such that the tail is out of the way of the surgical field. When you go to remove the tape, you don't need to do anything special with the pump. You just need to start peeling the tape from wherever it began to the site of the catheter. Again, this could be located on the leg, it could be located on the back for our rib fractures, so you'll just need to familiarize yourself with where the tape begins and where it ends at the site of the insertion. As you peel back the tape, you just want to be careful pulling gently on your skin, as we don't want it to harm your skin. And when you get to the insertion site, you will simply start to pull the catheter until it's completely out of your skin. We would like you to note that the end of the catheter should have a visible black tip. It's ever so slightly colored, almost as if someone colored it with a Sharpie marker. And we would like you to note that when you remove it. Another thing to point out about the pump is while you have it in place, you actually get a small pouch with which to carry it. This can easily be fitted in here as well as the dial, such that all that is left is the tubing to your insertion point. This will make it very easy for you to get up and do items of daily living, like going to the restroom or going to your kitchen, as long as your injury doesn't prevent you from doing so. You can also do physical therapy with the pump attached, and it really should not hold you back in any regard with movement. You can simply wear it across your body if your injury allows. You can wear it around your waist, or you can have someone helping you carry it as well. I would also like to let you know that our team that takes care of you, myself as the nurse coordinator, and the provider that started your pump, will want to follow up with you daily. We want to make sure that you are safe and comfortable at home with this pump. So we will give you some discharge instructions before you go home that reviews all of the material you saw in this video, as well as a few visual aids. We also give you the website for the company that produces the pump. MyPainPump.com has many resources for our patients, from videos to brochures, how to remove the pump, and more. We also have a 24-hour, 7 days a week nurse hotline that is run by the company, in which you can call any time of day and get your questions answered. A nurse will directly answer that call and will help you in any way that they can. They can even FaceTime you, or you can send them pictures if you have any concerns about your pump while it is infusing. You also will have access to our providers for emergency purposes. And again, you will receive a call daily from myself as the nurse coordinator and/or from your provider. We want you to know that this is a safe and very effective way for you to have a different type of pain control after a surgery or an injury. While we cannot promise that you will not have to take any narcotics or any other pain medications, our goal is to decrease the amount of pain medications that might cause more side effects. The side effects of this pump are very, very small, and we educate you on those before you leave the hospital. You will want to call the emergency number if you experience any of those symptoms, and we will make sure you understand all of them before you leave. We think this is a great service to help our patients manage their pain in a much more diverse way, and we absolutely believe that we should offer our patients this type of non-narcotic pain care to help you as you heal. Thank you so much, and please don't hesitate to reach out to our emergency numbers should you need help, or to the on-cue nurse 24 hours a day. Take care.